Alright, this next short video clip regarding examination basics for lower cervical extension. Okay, we have our patient seated at the end of a treatment table, just like we did for flexion. Okay, and we want to see if all the segments are stable and okay. We should see good cranial to caudal recruitment of motion from upper segments down to lower cervical segments. What we're most going to typically find in a patient with neck ache is that due to disc degeneration, the C5 and the C6 segment moves too much and too soon. We'll look for a visual indicator of that, and then again we'll test that passively. Okay? So, Hannah, we're going to have you look up at the ceiling as best as you can, and then bring your head right back to mid-position. And with that first repetition, I looked at C2, 3, C3, 4. Now I'm going to set my eyes down maybe to 4, 5, 6 right here. And I would like you to extend again. And now back to mid-position. And what I was looking for was called early excessive extension at either 4 and in particular 5 and 6. What that looks like is you would see movement here in those segments, 4, 5, and 6, start first before you saw movement in C2, 3, C3, 4. And Hannah's neck's in pretty good shape. She shows a more normal pattern. She shows a lot of movement at 5 and 6, but her 2, 3, and 3, 4 move first like they should. So just one more repetition for everybody to see. Look up at the ceiling. We see pretty good cranial to caudal recruitment of motion into extension. Now let's look at a passive segmental technique for the same thing, and let's go to where pattern recognition tells us to go. We know 5 and 6 will typically loosen first on most patients, and most commonly those are the ones that become irritated. So let's find the C2 vertebrae. Easy to find that big spinous process and the big lamina. And then I go to the C2, 3 interspace, 3, 4 interspace, 4, 5 interspace, and I'll stop at the 5, 6 interspace. I'm going to produce just a small amount of passive cervical extension, and if this disc is okay, the 5th cervical disc, we should not see or feel any motion. I think you can see that that's quite stable. If Hannah had discogenic instability at the 5, 6 level, this level right here would be moving with just this small amount of passive cervical extension. Let's go to the next segment down, the C6 segment. Same deal. If the disc here, the C6 disc, was not okay, we would see immediate, or what we call early excessive motion at the 6, 7 motion segment. And that's going to be one of the more common movement impairments that you'll see in many adult necks, folks with neck ache who have neck ache due to early grade disc degeneration.